The jar of dried ginger powder in your cabinet right now is doing something your fresh root physically cannot. A 2019 analysis published in the Journal of Agricultural and Food Chemistry found that the heat conversion process most people have been quietly warned against, drying, cooking, concentrating, produces a compound up to 10 times more potent than the primary active molecule in raw Zingiber officinale. And the second problem, the cellular pathway this compound activates, is the same one targeted by one of the most prescribed metabolic drugs on the planet. If you're using ginger specifically for metabolic health, blood sugar regulation, energy metabolism, insulin sensitivity, the form you choose determines whether you're getting a culinary experience or something measurably closer to a clinical effect. The gap between those two outcomes isn't marginal. Researchers measuring AMPK phosphorylation, the cellular energy switch at the center of glucose metabolism, found that fresh ginger essentially flatlined on the pathway that matters most. The dried form didn't. And there's a third variable, one that almost nobody factors in when buying ginger in any form, that determines whether either version of this compound actually reaches its cellular target at all. In 2020, a research team at Jiangnan University's School of Food Science published direct comparative measurements of 6-gingerol, ginger's primary bioactive compound in raw form, against 6-shogaol, its heat and dehydration-derived transformation product. Their analysis found shogaol concentrations in standard dried ginger powder running between 4 and 15 times higher than the gingerol equivalent found in fresh root by dry weight. That's not a small optimization gap. That's effectively a different compound with a different molecular structure and a different set of cellular targets. The supplement industry has been producing standardized ginger extract products since the early 1980s. Most of them are still standardized to gingerols, the compound the research moved past a decade ago. The label says standardized ginger extract, and the measurement is technically accurate. The measurement is just tracking the wrong thing. Here's how the distinction was actually discovered, and the trail begins not in a laboratory. Traditional Ayurvedic medicine maintained two separate categories for ginger for over 2,000 years: shunthi, the dried root, and ardraka, the fresh root. They were never treated as interchangeable preparations of the same thing. Shunthi was specifically prescribed for metabolic conditions, joint inflammation, and what practitioners called ama, a term roughly translating to accumulated metabolic waste. Ardraka was reserved for acute digestive complaints, nausea, and fever reduction. Two different plants in the same practitioner's hands, sourced from the same rhizome, separated only by whether heat and time had been applied. When researchers at Kyoto Pharmaceutical University began mapping the chemistry of this in 2008, they identified what the dehydration process actually does at the molecular level. Above roughly 60 degrees Celsius, gingerol molecules undergo a dehydration reaction, a beta elimination that removes a hydroxyl group and forms a new double bond in the carbon chain. The result is shogaol, a compound with a longer hydrophobic tail, higher lipid solubility, and dramatically increased membrane permeability. That last property changes everything, because the primary intracellular target of shogaols isn't in the gut lumen, where gingerols do their best work. It's inside the cell. And the specific intracellular target, the one that connects this food compound to a $9 billion pharmaceutical drug category, is AMPK. Metformin, the first-line drug intervention for type 2 diabetes, prescribed to over 150 million people globally, works primarily by activating AMP-activated protein kinase, not by mimicking insulin, not by blocking glucose absorption at the intestinal wall, by activating the same cellular energy-sensing enzyme that 6-shogaol activates. AMPK is the master metabolic switch. When it's phosphorylated, turned on, it triggers GLUT4 transporter mobilization, which moves glucose out of circulation and into skeletal muscle cells without requiring insulin signaling. It upregulates fatty acid oxidation. It suppresses hepatic glucose production. It's the switch your metabolism is supposed to hit automatically during fasting and exercise, and in metabolic syndrome, it stops responding normally. A 2013 paper by Ko et al. In PLOS 1 demonstrated that shogaol-enriched Zingiber officinale extract produced measurable AMPK phosphorylation in human skeletal muscle cell lines, the same signaling event metformin triggers, through a partially overlapping mechanism involving mitochondrial complex 1 inhibition and the resulting rise in the AMP to ATP ratio. This does not mean ginger is metformin. The potency levels are not comparable. The delivery mechanisms differ significantly. Nobody is suggesting replacing a pharmaceutical intervention with spice cabinet contents. But when a dietary compound activates the same master metabolic switch as one of the most studied drugs in modern pharmacology, that is not a trivial observation. That is a signal about which biochemical pathway this compound was shaped, across evolutionary time, to interact with. So why does almost every popular video on ginger still open with the nausea segment? Because the AMPK research is harder to explain. In 45 seconds, the human trial data is still small cohort, and ginger settles your stomach is a sentence that closes itself. The metabolic story requires sitting with the biochemistry long enough to understand why the molecular structure of the compound actually matters. And most content is not designed for that. 3 layers. Each one changes how you'd actually use this. When you buy a ginger extract capsule, look at the label. If it says standardized to 5% gingerols, that standard was established in the early 1980s, based on the then available research, before shogaol pharmacology existed in the literature. The supplement industry adopted the gingerol measurement because it was the first measurable bioactive marker, and that standardization crystallized into regulatory norms, supplier specifications, and product labeling before the follow-on science arrived. A 2022 systematic review in the journal Nutrients confirmed that gingerol-based standardization remains dominant in commercial ginger supplements, despite the shogaol literature being nearly a decade old. This matters in a specific practical way. A supplement capsule standardized to gingerols can accurately represent the fresh root phytochemical profile and still be largely inactive on the AMPK pathway you're buying it to support. The fresh root in your kitchen, the tea you're steeping, and the capsule on the health food store shelf are all technically ginger. They are not pharmacologically equivalent for metabolic applications. Going back to where this started, the jar on your counter, powdered dried ginger is, by default, shogaol dominant. The heat and moisture reduction during commercial drying performs the molecular conversion automatically. You've had a more bioactive metabolic compound in your spice cabinet the entire time. This is where a second, independent pathway enters the picture. A 2022 study in NPJ biofilms and microbiomes identified that gingerol and shogaol derivatives from Zingiber officinale preferentially support the proliferation of Akkermansia muciniphila, a keystone gram-negative bacterium that colonizes the mucosal layer of the large intestine and is now one of the most intensively studied organisms in metabolic microbiome research. Akkermansia muciniphila levels are inversely correlated with obesity, type 2 diabetes, cardiovascular disease, and inflammatory bowel conditions in multiple large prospective cohort studies. Lower Akkermansia counts are a consistent metabolic risk marker. The bacterium supports mucus layer integrity, reduces intestinal permeability, and suppresses metabolic endotoxemia, the chronic low-grade inflammation that contributes to insulin resistance independently of caloric intake. Ginger compounds supporting Akkermansia proliferation means there's a microbiome-mediated secondary pathway for metabolic benefit operating alongside the direct AMPK effect. Two independent mechanisms, both pointing in the same direction. That convergence is not common in nutrition research. Most dietary compounds show one mechanistic pathway and a lot of speculation about the rest. When the in vitro cell data and the microbiome ecological data align, the signal is stronger. Shogaols are hydrophobic. Their lipid-soluble molecular structure, the same property that lets them cross cellular membranes, also means they dissolve poorly in water. When you brew ginger tea from dried powder, you're extracting a fraction of the available shogaol content. The water doesn't carry most of it. You're drinking the gingerol remnants and leaving the shogaols behind in the sediment at the bottom of the cup. A 2017 study in Food and Function measured plasma shogaol concentrations following identical doses consumed under different conditions. Fasted with water, with a moderate fat meal, and in oleoresin form. The moderate fat meal group produced substantially higher peak plasma shogaol levels than the fasted group. The oleoresin group, ginger's oil-based lipid extract, showed the most consistent and sustained absorption profile across subjects. This has a direct practical implication. If you're adding ginger powder to hot water in the morning on an empty stomach, you're optimizing for bioavailability failure on the compound that matters most for the metabolic outcomes you're targeting. The same dose consumed 30 minutes into a meal that includes a fat source, olive oil, eggs, avocado, full-fat dairy, produces a meaningfully different plasma concentration. There's something uncomfortable sitting underneath all of this. For decades, the dominant nutritional narrative has been less processing, better outcome. Fresh is superior to dried. Whole is superior to extracted. The closer a food is to its raw, unaltered state, the more of its value survives. And in many contexts, most contexts, that's accurate. Heating destroys vitamins. Refining strips fiber. Industrial processing optimizes for shelf life and profit at the expense of nutritional density. The fresh is best framework came from real observations about real harms. But Zingiber officinale is a case where a traditional food technology, controlled dehydration, precise heat application, was producing a more bioactive compound for specific applications, at scale, for thousands of years, before any of the molecular chemistry existed to explain why it worked. The Ayurvedic practitioners who maintained separate categories for shunthi and ardraka weren't making philosophical distinctions. They were documenting clinical observations across hundreds of generations of use. The distinction wasn't about preference or cultural tradition. It was about observed outcomes in specific conditions. When 21st century mass spectrometry confirmed the molecular mechanism behind that distinction, it wasn't a discovery that the ancient practitioners were right. It was a confirmation of what careful, long-term observation produces when it isn't discarded. What this really raises is a harder question about how we evaluate food and medicine. and which forms of knowledge we count as evidence before we have the molecular tools to explain them. The natural versus processed binary is too simple. It always was. The relevant question is what the processing does to the specific compound you're trying to deliver to a specific biological target. And that question doesn't have a one-size-fits-all answer. So here's the practical answer to where this started. For acute digestive complaints, nausea, or motion sickness, fresh root or a simple tea works. Gingerols are appropriate for those applications, and the research supports them there. For metabolic support, blood sugar regulation, insulin sensitivity, the AMPK pathway, dried ginger powder, or better, an oleoresin extract standardized to shogaol content rather than gingerols, consumed alongside a fat-containing meal, is the formulation that the current research actually supports. Not every morning, not in unlimited amounts. The therapeutic range in the clinical literature sits between 1 and 3 grams of dried powder equivalent daily for metabolic applications. Above that, the data gets thinner. That's the surface answer. But the deeper question is this: how many other foods have traditional preparation methods we've systematically abandoned in favor of the fresh is best default? And how many of those methods were performing bioactive transformations we simply don't have the research infrastructure to document yet? Ginger is one data point. It won't be the last.